So this is a loading technique to the front part of the hip. That's this tissue right in through here from right about the belly button level to right about more than halfway up the thigh. So what I'm going to do is I'm going to use a ball or I can use a foam roller. I'm going to demonstrate with a ball because it is smaller so it can kind of wiggle its way into the target tissue that I'm trying to aim for. So you can do this lying face up or you can do it lying face down. I'm going to actually demonstrate lying face up. But first I want to show you where this ball should be. So if my belly button is right here, I'm going to go out about an inch and down about an inch, kind of right through that area. And then from there I'm going to have about a circumference around that area that I'm going to explore. So I can go up a little bit, to the side a little bit, and all the way around and through that area. So I'm going to hold that position right here. I'm going to lie face down. Now you won't see this much when I'm lying face down, so I'm going to verbalize what we're actually doing. So I'm going to lie face down just like this. Now you can actually use a bigger ball too. It allows your body to drape over the ball a little easier. So from there I'm just going to go slowly into that tissue. Then what I'm going to do is I'm going to take a breath in, and when I exhale, I'm going to allow my body to just drape over that ball, the whole ball. Kind of like it's a glob going over the ball. And then I'm going to breathe again. Inhale. When I exhale, just trying to sink in a little bit more. And then I'll try that one more time. Inhale and exhale, and just allow my body to sink in. If I want to try to get a little bit more of a load to the tissue, I can bend my knees some, about 90 degrees, which I actually feel a little bit more. And if I want to swivel my leg in or out, that might add a little bit more load to that tissue. And then once I find a new load or new experience, I'm going to hold that there, and I can, again, work on breathing. Inhale, exhale, and just try to allow my body to drape over the ball. Inhale again, and exhale. And this is a slow process. It's not super fast. I might be going fast just so I can kind of show you the technique of how this is done.